just straight Foley care, as well as watching for Foley infections, urinary tract infections. And then it says here, catheter-associated urinary tract infections. They're the most common type of hospital-acquired infections. And even though it is a hospital, we still have to make sure that we maintain that cleanliness here, and we don't want them to get an infection here in this building. And of course, their biggest risk factor is prolonged urinary Foley catheter use. So how can we prevent the urinary tract infections? Of course, we're going to always assess every time you're in there, if you're doing any kind of care, bathing, anything, always assess that Foley catheter. Make sure that you do Foley care, especially after they've had a bowel movement. And there's also alternates. You know, where not all patients need a Foley. Make sure that they're either in a clean bed. They can have condom catheters if they're a male. There's also those new catheters that actually attach to the outside of a woman's perineal area, and then it urinates, and then when she urinates, it dribbles into a bag too. Those have a tendency to come off quite a bit, especially if the lady's moving around a bit. So they will come off, and then of course you've got all the mess underneath them. So, and frequent checking, always frequently check your patients. So if they have what they call the stat lock, which is mostly for male patients, that way there's not a drag on their penis, make sure that it's locked well and that you have some slack between the end of the penis and that stay lock that's on their legs. Also, after a few days, you may want to remove that stay lock because it can do damage to that tissue underneath it. So it should be removed. Then also, is the bag empty, full? Make sure that you keep it clean. Also, if you have patients that are in bed, get one of those bath buckets and put the Foley in the bath bucket, the Foley bag in the bath bucket. That way it's not riding on the floor. That's also a vector for infection. So make sure that it's in a protected little container like those bath things. And then also make sure that that none of the tubing is linked or is kinked or looped. And also make sure that whether it's male or female, that the tubing always comes over the top of the leg and not underneath the leg or not under and on their buttocks areas. They can develop deep tissue wounds from lying on that Foley catheter tubing. So always make sure that the catheter tubing is on top of the leg. You should conduct a Foley assessment at least once a day. Always go in there and check it out. Make sure that it isn't kinked, that there is good drainage in the tube. Is there any color change? Does the bag need empty? Does it look like it's being pulled a lot on that urethra? So make sure all of those things when you go in and assess that patient, that it's not pulling and jerking on them. So of course, when you do assessment, we're not going to put a Foley catheter in somebody that's incontinent just for our, convenience, or if they're immobile, or if it's for obtaining any kind of urine specimens. It should always be ordered by the doctor, always. So what we're going to look for in a male patient if there's a problem is you're going to look for inflammation, swelling, or drainage, especially around the penis and down the first part of the tube. If possible, ask patient whether there's any burning or discomfort. There's always going to be some discomfort, especially more for gentlemen than there is for women, simply because it's a longer urethra up in there and there's more to pull on, so they are going to feel a little more discomfort, just as long as it's not extremely painful or you don't see any bad discharge or change in the urine. When you clean it, you're going to clean from the tip of the penis, starting at the urethral meatus, and then work down in a circular motion, down and away from the tube. And then when you go to clean him, you're going to clean from the tip of the penis back towards his body. Okay? So you're actually going to do two cleanings, the catheter tube first and down, and then from him and back up towards him. Now for a woman, again, You're gonna look for any kind of inflammation, any kind of swelling, any kind of discharge there. Again, ask her if she's uncomfortable, if she feels pressure. Sometimes you can even touch the bladder, and that will indicate if it's really uncomfortable, they may have a UTI. They may not have any outward symptoms, but if you palpate, notice they're a little bloated, and you palpate and think, oh, and that hurts them, then let us know, and then it could be a urinary tract infection. Now for a woman, we're gonna clean the perineal area. You're gonna start at the top and work down towards the bottom. You're gonna start at the catheter again, work down towards the end of the tubing. So again, same with the man, do the tubing and down that way in a circular motion all the way down, and then cleaning the perineal area of the woman. So what you're gonna do is you're gonna stabilize that catheter with your dominant hand. Okay, so get on that side of the bed too. Make it easy on yourself. Get on that side of the bed. Make sure you have all of your equipment there, everything that you need. Raise that bed up. Don't bend down. Raise that bed up. Get either him or her into a lithotomy position, which usually is up like this, the legs up like you would for a pelvic exam. And then you're going to use clean washcloth, soap, and water. If your soap is really strong or your patient has really sensitive skin, go ahead and dilute that soap a little bit. It's okay. It is okay. Then you're going to clean the catheter, starting at the catheter where it enters the body, down towards the drainage tube in a circular motion for at least 4 inches. So you're going to go down quite a ways. You don't have to clean the whole tubing down, but you do need to clean down. Okay? And then of course you're going to document it. You have to document it, because if you didn't do it, if you didn't document it, it didn't get done. So there is some alternate to Foley catheters. For men, again, we use the condoms catheter. A lot of men will leave it on, some won't. Or you can take them and have them toileted every 2 hours, which is a lot of work for you guys, because you don't always have every 2 hours to be with a patient. You can use the commode, bedside trans, urinals. We don't recommend intermittent catheterization unless they're having some residual problems. And it's just, and then you're really, if you do the intermittent catheterizations, you're taking a higher chance of introducing infections again. So the whole idea is to make sure that you do not have an infection while the patient's here. Just make sure that you put absorbent chucks or briefs underneath the patient. Keep them clean as often as they urinate. And especially if they have a bowel movement, it's really important after they have that bowel movement. Even if you've done your peri-care that morning, if they have a bowel movement, you gotta do peri-care again, because they will get an infection. And E. coli is probably one of the most common causes of urinary tract infections, especially in women. You guys have any questions at all?